Hello guys, we are going to look at another interesting topic in medical surgical nursing on the assessment of patients with respiratory tract disorders. The assessment of patients with respiratory tract disorders. When you are assessing the patient with respiratory tract disorders, you can carry out the following investigation, like history taking, lab investigation, radiological investigation, and pulmonary function tests. History taking, lab investigation, radiological investigation, and pulmonary function tests. The history taking include the following: the history of cough, the history of cough. The history of cough include the following abbreviation is usually used when you are taking the history of cough, like PQRST. PQRST is abbreviated when taking, is the abbreviation used in taking the history of cough. P means provocation. Is there anything that provoke the cough? Or did the person cough as a result of a substance inhaled, like dust, like pepper, smoke? This can provoke the cough. Palliation. Did the patient take anything that make the cough to subside? Palliation. P may means provocation or palliation. Provocation is, did he take anything that make the cough to be aggravated? Palliation. Did he take anything to make the cough to be subsided? Like taking of cough suppressants or antitussives. The Q means the quality of cough. Quality of cough. How is the cough? Is he coughing with, is the cough racking? Is it shallow? Is it rattling? Is he having a wheezing cough? Is a cough coming out with sputum? And so on. The next one is the R. R means respiration. The region means region. Where is the cough coming from? When coughing, is he having feeling any particles in the neck? Or is he feeling congestion in the chest? Or is there any sputum or mucus that is blocking the nose? That is R. R is for region. S means severity. Is a cough mild? Mild, depending on how frequent the cough is. Is he coughing always or occasionally? Mild, moderate, and severe. T means time. For how long has he been coughing? For how long has he been coughing? You have to also take the history of sputum. Sputum. The history of sputum. The nature is the sputum mucoid, watery, purulent, tenacious, frothy, bloody. The color, is the sputum dark or stained with blood? Or is it gray? Frequency, how frequent is the sputum? And consistency. Breathing, the patient may complain of breathing difficulties. For example, at night or when he is doing any form of exercise. How is he breathing? Is he breathing within normal range or he has breathing difficulty? You have to also take the history of fever. Is he having high body temperature? If the patient is having high body temperature, it's a sign that he is having respiratory tract infection. High fever is a sign that the patient is having respiratory tract infection. The next one is pain. Take the history of pain. Is the patient feeling any form of pain when coughing? Is he having history of pain when coughing? Or where is the pain? If he's having pain, is the pain in the chest? Or does he have pain in the night? The history of treatment. What medication has he been taking? What medication has he been taking? After the cough, how long and what have you done to make the cough to subside? Or what did you do when having the cough? The history of activity. What activity did you involve in? What occupation are you doing? Is the patient working in block industry or mining industry? Or is his occupation grinding? If his occupation is grinding, that may be what is provoking the cough. The physical examination. You have to inspect the patient or carefully observe the patient for paleness, obvious distress. Is he breathing with difficulties? Running nose. Is he having running nose? Dry mouth. Auscultation. Auscultate the apex of the chest for depth or shallow breathing. Palpate. This method is used to examine the chest excursion for symmetry, structure, and abnormality. The imaging studies. The X-ray of the chest may be done to check the structure of the respiratory organ or to check the structure of the diaphragm. When there is fracture of the diaphragm, it may affect respiration of the patient. Lab investigation, which may include the white blood cell count. If the white blood cell count is elevated, It may be a sign of respiration. Sputum MCS is very important. The blood MCS to determine the causative organism. Thank you for listening. Like, you may make comment or ask question regarding the lecture. I will respond to you in the next video. Feel free to like, subscribe. Thank you.